we are waiting. So I clicked on mine as go live.
Yeah, I see it now. I just clicked on mine. It says we're live.
All right, well, we are live. So today is January 8th, Friday. This is our weekly session. We are going to cover different topics, mainly COVID related. I have Tanner from our business development with me. Today we prepare some updates for everyone. My name is Kemal Erkan. I'm the chairman of United Medical ACO. And Tanner, if you can also introduce yourself.
Sure. My name is Tanner Fuchs. I'm with the business development team here at United Medical.
Thank you. And so what we try to do in these events, just to go through some of the weekly updates, mainly it is the process that we go through. And in some ways, I find this as like a good outreach to the patients directly. Also explain them what's happening in our day-to-day life, which is relevant for them because we are delivering the healthcare in Delaware, especially. So today we are going to discuss the COVID-19 numbers and the vaccine update. And the main topic today is going to be the vaccine distribution issues and why we are having these issues, and if it could be, did we see this coming? So that's like one of the main problems that we have, and then how actually it can be improved, even it's not still too late. So we are going to discuss those issues all together. Now, I'll start with the year-to-date number, total number of deaths. We are at 374,000 as of this morning. Now, if we were to break this number into daily, the last 3 days, I do believe that it's important for us to see. So 2 days ago, we were at 261,000. And then this was one of the highest daily number of deaths, 4,100. And yesterday, that's now at 4,200, which I think this is the record's highest daily number, 279,000. Again, we were expecting these, but the problem is there are still certain things that can be done, and we do believe that it is important for us to still be careful with our choices, and if we can minimally contribute to the problem, that would be the best we can do. Now, I'm going to open the Delaware numbers. Delaware numbers, unfortunately, are not looking good. So we have highest hospitalizations and highest daily average numbers, highest percentages, and these are extremely concerning. And this is why, actually, one of the reasons that I actually make myself available for this event is because I do believe that we are responsible for letting everyone know why certain things are happening in the way that they are, and there are solutions. It's just like we are not utilizing the resources properly. So the current hospitalization in Delaware right now, it's averaging 453. There was a low day on January 6th. Now, this is not updated. It should be updated in the next hour or so. We don't have the January 7th yet. Tanner, I find this one, we shared this one with our providers last night. I find this number also pretty interesting in a bad way. This percentage of running totals, that's 28%. And our internal numbers, we were about 29% for last week.
Correct, it's just about.
And the percent of tests that are positive, so that's at almost 10%. So these are what we have, and the new positive cases. So right now we are at our highest number at 790, which is again really concerning with the daily totals that we are getting. So before we go through our other items, one of the forecasts, Tanner, if you want to explain this, what we have here, this is from CDC, And again, we share these with our providers on a weekly basis, twice a week. And this is from our last night's meeting.
Sure. So this is the most recent updated forecast coming out of the CDC for projected deaths by January 30th. So looking towards the end of the month, that from where we're at now is an additional about 60,000 deaths that they're forecasting for this month. Now, this is something if you remember, Dr. Fauci had been discussing early before the holiday season that these were numbers that we could expect to see, unfortunately. So we're starting to see that spike initially now that we're after the holiday season, after the gathering season. So we're keeping an eye on this going forward. Looking here on the screen, you can see where these models are projecting, and we have the height or the high ends circled just so you can really grasp the number that we're heading towards. So hopefully that's not we can still have time to mitigate this. We're watching the data as it comes out, but we just want everyone to be aware that we're trending towards that higher end of the projections right now.
So again, with the holidays, right? We knew that some of this was going to happen.
And the holidays on top of the winter season, flu season.
Yes, together that makes the perfect storm almost.
Right.
And we are really hoping that it can be controlled. Now, this is going to get us to our own internal numbers, and if you can also explain these.
Sure. So as Kemal's mentioning, we're watching with the state data, we're also keeping our internal data for our patient population. So you can see here our positive number for tests coming back for our patients is trending upwards as well. Now, this is one of the higher positive numbers we saw with that end of year, the week of into the beginning of the new year. You can see that 29.5% positive with the amount of tests that our providers are ordering. That our patients are getting completed. So we're seeing a little bit of a dip in the amount of tests that are being ordered. That's what our graph is representing here. So we have that target line of 300. We want to make sure we're continuing to order tests for our patients so we can accurately maintain our data and really get a good number for how healthy our patient population is. So we took a little bit of a dip, Kemal, and that makes sense with the holidays. I know not as many people are thinking of going to their provider or requesting a test order. So we'd like to see that get back up here in the next couple of weeks, but it definitely helps us keep a good track or be confident in our number, positive and negatives that we're receiving.
No, that's again, like we are helping with the process in a way that we can actually give the most up-to-date information to our providers. And also, this is the way of us taking care of our patients. So now, one really nice maybe update from our ACO, United Medical ACO standpoint, although hospitalization is the record high, our numbers are very well controlled, actually slightly lower than our averages. We look at those numbers on a weekly basis, and we did not see any increase on our numbers. And we have the real data directly from DIN, from Delaware Health Information Network. You guys may remember Dr. Jan Lee. She's the CEO of DIN, who was with us a couple of months ago. So we get daily feeds from our admissions, and our numbers right now are extremely good on the hospital side, but overall the state numbers are not the case. So that's why we are kind of in a way we are concerned about this, so that we can help everyone to understand this better. And we also know what we are doing in a way that when we have to go through so many appointments, so many educational sessions, even for our providers, every time we prep for these events, we find more information useful for them, useful for us, and useful for the public. So that's kind of like the bottom line for us. So and I'm hoping that we can actually provide even more resource for everyone. Now, we are going to go through the COVID update. Now, we did this side-by-side comparison for everyone so that they can see the difference between Pfizer, BioNTech, and Moderna. And then as we have other vaccines available, we are going to include them in this side-by-side comparison. But right now, Tanner, the biggest difference that we see here is on the storage requirements, right? Which does make, I think it's important, right?
Mm-hmm. I think it's important, especially to have this side-by-side comparison. You can really see, for the most part, these are, like you mentioned, pretty similar when it comes to the side effects, but also the storage is really going to be the biggest difference here. So with the Pfizer vaccine, I know a big logistical issue in the beginning was making sure that it was going to be able to be transported and stored properly. That was going to be the problem that they were facing. That's at this time, we're making sure that that's not necessarily going to be an issue. I know a lot of practices or whoever is storing the system or the vaccines are making making sure that they're able to store this. But with Moderna, that's really the temperature in which we're storing vaccines for the most part. So that's definitely a plus on that side. So aside from that and the time in between the doses, we're really not seeing a whole lot of a difference, especially when it comes to the reaction or side effects, which is actually brings it to this point. This is just a study that's coming out from the CDC that for the vast majority of patients receiving both vaccines, we're not really seeing severe allergic reactions. I know we're seeing a lot of stories kind of in the news where small groups or certain individual instances of severe allergic reactions. That's all stuff that's being looked into. Of course, we're coming back now and still studying, but for the vast majority of people receiving this, we're not seeing those severe allergic reactions in any that are treatable.
Our concern, Tanner, with these types of news, like if they make the headlines, people don't read them. Mm-hmm. They just read the headline of someone has a reaction to the vaccine. Right. But out of 5.9 million so far is being administered. All of our United Medical ACO providers, I think 97% they already receive it. Mm-hmm. So there is no major problem with any of these. And I'm just worried that the media sometimes brings the attention to the wrong part, and it is affecting people's understanding. So, right. Now, here's the concern that we have 21.4 million doses have been distributed. And then 5.9 is completed so far. So now in Delaware, this is a little bit different. What's happening in Delaware?
In Delaware, we're seeing kind of the same issue reflected what we just saw with the national vaccine numbers, but a little bit even worse of a situation. So there have been roughly 64,000 doses distributed to the state of Delaware, but we're only seeing a very small fraction of those doses actually being administered. So down here, you see about 16,000. Kemal, that's only about 2.6% of our population thus far, and of the prioritized population, excuse me. So the population in which we wanted to see get vaccinated with this first stage, that 1A tier of the vaccination rollout, and we're only about 1.5% of the state's population. So this seems to
be, correct me if I'm wrong, but with the comparison with all the other states, I think we are like ranked 40.
I think it was mid-30s, something along those lines. It wasn't a great place to be in that list.
Yeah, I have that one, so I can. It's from the Becker's group, right? I thought were we 31 or 40? One of those. So number one is actually North Dakota, and then Here's the list in front of me, and
I want to say 31. I think that sounds familiar.
nope, you are wrong.
Oh, where are we?
Now we are 28. We were 31. You are right.
We were in 31. Yeah.
So now it's 28. So 25% of the population, not the population. Let me correct that. Actually, 25% of the vaccine given to the state is only administered by the state and the other facilities. Now we are talking about the phase 1A.
Correct. Yeah.
Now, Tanner, you are with United Medical not too long, right? So it's about 1.5.
Just about 1.5 years.
Okay, so you can correct me if I'm wrong, but I do have really bad number disorder.
No,
so
that's right.
So the problem is, in some cases, you would see us a little bit frustrated with the situations, the process that we are going through. Why is that happening? Is because there is a very bad misperception of what our private practices are doing in the healthcare and how the healthcare is delivered to the patient and who's really managing it, who's in charge of it. And I feel really lucky to have to be able to take advantage of these types of outreach directly, because in the old days it was extremely expensive for us to be on TV or on news channels to kind of make our point. And then this was one of the reasons for me to actually start writing different articles to make our points available and make people aware of what we are really going through. The perception that we believe that is extremely misunderstood in the society is healthcare is provided by the hospitals. And that is, we have nothing against the hospital. When it's needed, we are going to be utilizing it, no problem there. But if these are, if the default is the hospital for any type of healthcare need that you have, and then every time state officials, they have to process these types of deliveries, and then default again goes to the hospital, that brings us into trouble. So now what I mean, so we are going to actually kind of try to explain and walk you through, and maybe it will help, you'll help me with my therapy with this, because it is extremely annoying when you are not able to make an impact on people while you are actually doing the most of the work. So why we say most of the work is my organization is taking care of close to 15% of the Delaware's population. My doctors, when I say my doctors, I'm referring to United Medical ACO. These are private primary care, pediatrics, and specialties, and a surgery center, and a lab, and an imaging center. And these providers, these locations provide 12 to 15% of the population needs. We take Medicare, Medicaid, all insurances. And this year alone, as of November, we already reached out to 116,000 patients. This is a real number. So any of the state officials can come into my office, and then I can actually walk them through with the process. This is the number. This is 116,000, 428,000 appointments. So part of the issue is you have vaccine available, and we have a pandemic we are going through, Tanner. So then what you do is you don't engage us in the conversations. When I say conversations, there's a committee for the COVID, and we are not part of it. Who's part of it? The hospitals. Well, hospital is the end of the kind of like the circle in a way, cycle. So it's it shouldn't get to that. Why is the ACO is not part of this decision-making committee? And then when we are actually going through hospitals with these types of stuff, so then you complain about why the number of administered vaccination is low. We have 75% of the vaccine that's being given to us is sitting in the storage.
Close to three-fourths.
Pretty bad, right?
Vast majority of the vaccine rollout thus far.
So now, when we were going through this list of, let's see, when we say 116,000 patients being serviced through United Medical, who's doing that? Providers. Who's doing that? Is our medical assistants, our check-ins, our checkouts. Why is the state of Delaware is dismissing my people, my frontline employees who are putting their lives at risk, and then they don't make these things available to us and make it so difficult? So I want our patients to know this. I want our providers to know this, but I want public to know this. When we criticize people in charge, this is the reason for us, because we have a real strong data behind this, and then also we are very proactive. So Anthony Anuga is the director of contracting from United Medical, and he emailed the state officials on December 1st for them to make them understand that we are the ACO. We can actually be part of this as an ACO, so that we can handle what our provider needs to do. And then the state answer is, we urge that practices enroll in the vaccination program. Practices is for the state of Delaware. I have 60-some practices in Delaware only. When you say each practice needs to do this, and we have accountable care organization in place, why do you dismiss that and then just miss the opportunity and then force my doctors to go to the hospital to get vaccines, and some of them couldn't get it, still couldn't get it? Why are we doing the same issue? Say we are getting to the same problem again and again. Like we are going through this problem again and again. It's because we are not understanding where primary care and the specialties are, where the private practices are, where the accountable care organizations are. Governor Carney, if you are listening to this, one, you should really answer my emails at some point. I served at your committee for 2 years, and we don't have any animosity, and you should really not dismiss. If you are getting a pressure from the hospital that you want to dismiss the ACOs, I would like to know that. So I worked with you 2 years side by side. So we'll try to reach out to you again, but we won't go anywhere. Accountable care organizations and United Medical will be providing the services. You need to get your act together and then engage us, so that this is not a Christiana Hospital show. So here's why I'm actually at this point, so then people can also appreciate this. This is the flow of the patient's pathway. Tanner, when we say patient pathway, so you help me with these, so I want you to kind of help us with this diagram. So you have this, I'm assuming that this is related to, this is related to
the flow of the patient care.
Yeah, so from the prior page, so we have, everyone should remember this heart here, right? So then we bring them here. So that's where we are. So tell us what this does.
All right. We really wanted to demonstrate how the patient care doesn't necessarily start, and it does not begin with the inpatient care that you receive in the hospital. It's only very often a piece of the entire network of the patient care flow that we kind of laid out here. So it all starts with the primary care office. Primary care offices provide preventative care for our patients. We want to make sure the patients are staying healthy, staying on top of their health, and that doesn't start in the hospital system. It just makes sense, like looking on it from a flow sheet kind of perspective. Why would you incorporate or integrate some sort of rollout of a vaccine or inoculation system from really only a small piece of the patient's health? The heart of the healthcare, of the primary care, or excuse me, patient care services really starts in the primary physician's office. So I thought this was a good representation of that. A lot of people are visual learners, such as myself. So we put together some graphics to really emphasize and drive this home. And I think this is a really good one, showing that our groups of patients, our patient population, they're not jumping. You're only going to the hospital in case of emergency. We want to make sure you're there for emergency visits, or of course, like there are some procedures that may need to be happening in the hospital. But that's not our go-to. That's not where we're starting out. And I think that this shows that in a very visual manner.
Yeah, this one, again, the whole issue is what we are trying to emphasize here is patients.
Come on, if you can hear me, I may have lost you. I think I lost you.
Do you hear me? It's I think we are on.
For a second, I just got kicked off again.
Beste, if you are able to hear us, can you send me one more message, please? Okay, so Susan is in here us. Laurel, Rehoboth Beach, Lewis, and we have locations, and we couldn't incorporate the vaccine distribution through the ACO. That's a big failure. And then I have to go through like an individual vaccine process, and then you come back with some hub that we have to kind of be part of. That's ridiculous. And you are responsible for the vaccine distribution, and then we are responsible for the administration part of it. But before I do that, I need to get them, and we still don't have it. There's no reason for us not to have the vaccine today, and that's unacceptable. Now, we actually did a flu vaccine drive. Hazel DMAT, Susan Anderson, Ethan from the business office, with our practices all together. We did United Medical Clinic flu drive so that we can get close to 1,000 people in 3 days. And then just so that we don't have the hospital lobbying money in our hands doesn't mean that you dismiss what we do here in Delaware. We are Delaware. So you have to hear what I'm saying, and then you need to actually really make this, we are making this very clear to you. When you dismiss 180, 200 providers with 100 locations, and I have to struggle to get the vaccine, when the 75% of the vaccine is given to you, you don't actually distribute, that's not excusable. And what's happening in DC cannot shadow what's happening in Delaware. So those are different issues. So you really need to get your act together. You need to accept the fact that accountable care organizations are part of this delivery system. And we'll be here tomorrow. We were here yesterday and we are here today. So that's not going to change. What's going to change is this attitude, this behavior of the state towards to the private practices. Hospitals are already extremely expensive. So there's no reason for us to be in the hospital systems. We are providing and competing with those giants, even though they are given the name label nonprofit. That is not true. From the public data, we know that hospitals are making 100% profit. They have 100% profit margin for lab-related services, 100%, and they are nonprofit. Do you think we make 100% profit? That's not the case. So then they make 60% margin already on the high expenses. They add the margin to the surgery cases. Do you think we add 60%? No. So if we don't, and if this is there already in the system, and then we have these channels, so we are going to be available for everyone who wants to listen to us every week. So that's our goal for 2021. We did so many events. We reached to close to 3 million minutes watch between the different videos that we have done. And we are going to utilize our voice. We are going to make sure that our voice is heard by you and by everyone in the state of Delaware. So that's where we are from the vaccine standpoint. Now, well, my friend here, Tanner, did prepare some other stuff for us. And I think this is the example what's happening in India. So Tanner, tell us what's happening in India.
So this week, hopefully everyone can hear me all right. This week, the country of India is actually prepping to stage a mass inoculation rollout. So they're going to be able to, or hoping to be able to vaccinate nearly 300 million people against COVID-19, which is roughly the size or the population of the United States, about the same size. And they plan on doing this by early summer. They're going to begin next week. And it seems to be a testament to a strong vaccination rollout plan from the actual state of India. So just wanted to share that when the plans are in place and when the correct and appropriate preparations are made, that this can be a very simple and straightforward process. I think that this is a good example to the rest of the world of what can be done when they really put all the effort and use all available resources that they have available to them to vaccinate their population. So it's going to be something to keep an eye on and make sure, see how that goes. They plan on being able to get a vast majority of, I mean, they're the largest populated country in the world, I believe, right? Maybe them in China. So
it's about
it's a great feat.
Billion 350.
Right. It's a great feat. So, I mean, that's about roughly the size
So
of the
what's
United
interesting
States.
with this one, Tanner is right next to me and we are keeping the social distance. So what's happening, I think if the country like India is able to distribute 300 million vaccine, United States should be able to do this much quicker and easier.
Very effective.
Right, so we have more resources.
If I'm not mistaken, I think so. I was actually just reading about this morning, but they were just this past week or the week previously had the approval for the Moderna and the Pfizer vaccines. So they're getting all this done in a matter of weeks after the approval of the vaccine, which is very impressive. There doesn't seem to be much lag time in the preparation, so they're well on their way. As is to getting a large amount of their population vaccinated for the amount of doses of the vaccine that they have, going back to the numbers that we were looking at for our by state.
Yeah, that's very good. Thank you. So what else do we have? Well, again, please still keep the measures that we have for safety. Stay home as much as possible. This is going to be the only way that we can go through what's happening. Our patients at United Medical, please utilize the portal. I know from United Medical Clinic, we are not taking certain phone calls if it can be done through the portal, and we want our patients to save their time save our time so that we can be available for others who really need us on the phone. So utilize the portal. Utilizing the portal is the only choice. Now we have done. We started our bariatric events this week. We discussed the intermittent diet with Dr. Erkan from CRIAS. That was our second time covering the intermittent diet. And if you haven't watched it yet, you should definitely go ahead and watch those in our YouTube channels. They are not just for the patients with obesity, but for those who are struggling with weight loss or understanding what to eat, what not to eat, and when to eat. They are extremely, there are a lot of good information there, and Dr. Erkan is one of the best in his specialty. Now, this Wednesday, other than our regular Wednesday event and the Friday event, we have our Wednesday wellness webinar with Amy, and we are going to go through the diabetes education. This is at 7 p.m. And feel free to sign up for that event as well. And as usual on our YouTube channel, there are all these videos available now, and feel free to watch them anytime. So again, our goal is pretty clear, and because it's going to be weekly events, so I don't want to actually just repeat the same thing again and again, but we want to discuss our struggles while we are going through the system, while we are trying to do our jobs. We handle patient care. We don't sell cards. We don't sell anything. We provide service. We provide, when we don't do our jobs right, there is a consequence of people's lives in danger. Because of that, it's extremely important in a way that we cannot fail. So we need state of Delaware officials to listen to this conversation very carefully. We represent a big part of the patient population here, and we are one of the 4 ACOs. We are one of the ACOs who has the best quality metrics. We are one of the ACOs who started the Medicaid ACO programs. So we cannot be invisible just because we do something in a better quality and less expensive doesn't mean that you dismiss us. So please hear what we are saying, and then make sure that we make these changes. So then our goal is to reach out to our patients and make these things available. Now, I'll close the session by just saying that there are some people, they still have these really crazy ideas in their mind, and I do respect and we agree to disagree, but stupidity is something that we are not going to agree on. There's a public health crisis here, and the vaccine is the only solution. And this is not just your life, but this is everyone else's life around you. So vaccine is the only solution. Please watch our videos. We have our providers put one video together so that they're all vaccinated right now. So, I mean, if you are 75 years old and then worried about this vaccine having side effects, well, Dr. Erkan got his vaccination. He's in his mid-50s, and he's a bariatric surgeon, father of 4, and he got his vaccine done. Are you saying that you are smarter than him? Dr. Wasif Qureshi, the father of 3, 46 years old, and he's a cardiologist. He got his vaccination 2 weeks ago. I mean, this is a choice that's extremely clear. So let's not make any mistakes by following the wrong media channel. So just stay with us, and then we'll be back next week. Thank you so much. Bye-bye.